Assalamu alaikum wa rahmatullahi wa barakatuh. Patients arrive at a hospital or clinic with symptoms that may or may not be MERS coronavirus. All suspected cases should have specific laboratory testing to establish a diagnosis. A confirmed case is a suspected or probable case only with laboratory confirmation. First, collection of laboratory specimens. All healthcare workers need to have protected exposure before taking any specimens. Protected exposure is wearing personal protective equipment, PPE, while within 1.5 meter contact of all confirmed or probable cases. Correct hand washing techniques must be undertaken before you put on your PPE equipment. PPE equipment is a surgical or N95 mask, waterproof gown, gloves, and when indicated, eye goggles. All suspected cases should have a nasopharyngeal swab taken, and if or when they are intubated, lower respiratory secretion samples should be collected. It is strongly advised that lower respiratory specimens such as sputum, endotracheal aspirates, or bronchoalveolar lavage should be used whenever possible. Collection of other specimens is recommended. These are stool, urine, and serum for MERS coronavirus PCR, as the virus has been found in these body fluids. When taking specimens from a suspected MERS coronavirus patient, it is essential to use protected exposure procedures. It is important for other laboratory tests to be taken at the same time to rule out other possible causes of fever or pneumonia. These tests are influenza A and B, respiratory syncytial virus, Streptococcus pneumonia, Haemophilus influenza, Staphylococcus aureus, Legionella pneumophila. Remember that testing for MERS coronavirus and other respiratory pathogens should be done at the same time to reduce the risk of spread of any infection. If there is clinical evidence of acute fever and history of exposure to other tropical diseases, then specimens should be taken for dengue fever, Al-Khumra hemorrhagic fever virus, typhoid fever, and malaria. It is important as a doctor to take specimens to ensure an accurate diagnosis and rule out other conditions that may show similar signs and symptoms. Repeat MERS coronavirus test every 3 days. Secondly, handling of laboratory specimens and biosafety. All specimens should be considered potentially infectious, and all healthcare workers who collect and transport should wear appropriate PPE equipment to minimize exposure to pathogens. All staff who transport specimens should be trained in safe handling practices. If any spillage happens, decontamination procedures must be carried out. All healthcare workers should notify the laboratory that specimens will be transported and deliver all specimens by hand whenever possible. All specimens for transport have to be in both primary and secondary containers. The specimen container is a primary container, and with it should be a clearly written request form. The secondary container is a leak-proof specimen bag that has a separate and sealable pocket for the specimen, such as a plastic biohazard specimen bag. With clear identification of the patient's label, it is important to remember that you are not alone in your decision-making. There are specialized teams to help you, and it is important to keep them informed.